Typically, athletes want to heal as quick as possible. So to me, the best accelerated option for an athlete to accelerate healing is prolotherapy. You know, like in other words, when an athlete injures themselves, guess what their body's trying to do? Do prolotherapy. Like when you injure your ligament and there's inflammation there and the body's trying to heal it, you know, with fibroblasts and everything, that's prolotherapy. So if your body can't do it, like if you know after 2 or 3 weeks, this is a really serious injury, even if you go to the doctor and the doctor's saying like, man, you almost completely tore this ligament, or it's still black and blue, or it's still awful, and you want to accelerate the healing, just why don't you get prolotherapy? I mean, the body's trying to prolotherapy it, so why not do prolotherapy on top of it? So often when athletes come in right away with an acute injury, it's normally just 1 or 2 visits. In other words, you could have an ankle sprain and man, it's going to be 3 months. It'll be 3 months if you just do the normal stuff, especially if you do anti-inflammatories and ice and all that stuff and you stop the healing. Whereas if you get prolotherapy, probably you cut the recovery time in half. Boom, you cut the recovery time in half. And then the other thing too with prolotherapy is normally you're exercising right away. And do you know, as an athlete, for every day you don't work out and you're not doing anything because the doctor's got you in a boot, or some other thing like they're immobilizing it, it takes 2 days to recover. So for the example, you got an ankle sprain and you're really not doing much for a few months, just to get back to the level of athletic performance that you were prior to the injury, it'll take you 9 months. 3 months of the immobility or the limited activity, and then 6 months of recovery. So imagine if you get a really bad ankle injury, like 2 days later you come in for prolotherapy. Then right away you start exercising. Yeah, so then basically in 6 weeks, you should be back to the way you were. So instead of like 9 months, it's just 6 weeks. So I mean, I'm not sure anybody can accelerate recovery more than that. So as athletes get helped by either chronic injuries, often they'll come in right away for their acute injury. I'm reminded of a person that does trapeze. You know, she does the double flips with the trapeze. So she came in one time, she had chronic injuries, got her back to trapeze, and she had a back injury, and she wanted my opinion of it. And I'm like, Jerry, you know, you haven't done anything else. You haven't done physical therapy, you haven't done this and that. And she's like, yeah, but how many prolotherapy treatments would it be? And I said 1. She goes, I'm in. You know, like in other words, like, who has time to be going for 12 visits of physical therapy? Or she just wanted to be back as quick as possible. So I think in many times, even though it's an invasive procedure, it's actually very, very cost effective, because in her case, bam, 1, you know, prolotherapy visit, she was back to exercising, not trapeze, but she was back within a week exercising, maybe, you know, within like 6 weeks or whatever, she was back to trapeze, even though she had a significant sacroiliac injury. So sure, she could have gotten chiropractic care. Sure, she could have gotten some physical therapy. She could have done some other things. I just wanted to make sure she knew her treatment options, but she's like, I don't got time. I got a busy practice. I don't got time to be 10 visits to the physical therapist or the chiropractor. So prolotherapy, it's 1 visit. It's boom, 1 visit. So in that sense, you know, it might be more cost effective, and absolutely it'll get the athletes back quicker.